Now, 8 years after the implementation of the local content LI 2204 of 2013, a Ghanaian firm has exceeded the target set for one of the major support services to the oil and gas industry. Sycamore Medical Centre in Takoradi, an indigenous health facility, currently has 85% share in the provision of medical services for all offshore oil and gas workers, exceeding the LI's target for local participation. Our Western Regional Correspondent Akwesi Ejenim takes a look at how the Ghanaian health facilities rubbing shoulders with foreign health facilities in the petroleum industry.
The high expectations that Ghanaians met with the Jubilee Oil Fields commissioning in 2010 is what resulted in the passage of the Petroleum Local Content and Local Participation Regulation LI 2204 in 2013. Key among the purpose of the regulation is to develop local content capacities in the petroleum industry value chain. In the area of medical services to the oil and gas industry, the regulation set a target for Ghanaians to offer 40% medical services at the start, then increase the Ghanaian share of medical services to 60% after 5 years, followed by 90% share after 10 years of the implementation of the law. However, with 2 years more to go before the attainment of the 90% target, Sycamore Medical Centre in Takoradi, an indigenous health facility with just 15 years in existence, today has attained 85% share of the medical services to the offshore petroleum industry.
It's been a journey working with the oil and gas industry. And I remember when we started, there was one foreign company or foreign provider who was around, and I know it's still around. But for us, we keep the focus.
I asked the medical director of Sycamore Medical Centre how they got here.
In fact, we have been accredited by UK Oil and Gas, what we call the OGUC. So we provide medical examination. We examine those who go offshore. And so I'm also a United Nations physician. So I see the United Nations workers in Ghana here. I also provide orthopedic and trauma services.
To allow the public to appreciate the excellent medical services it offers, they opened their doors on its 15th anniversary. City Business News spoke to some of the patrons of the hospital.
We came here this morning looking at things that they have, the facilities, and then the customer care that they offer to us is very wonderful. And I hope that other hospitals should learn from what is happening at the Sycamore Medical Centre.
But what is next for Sycamore in the area of general and petroleum services for the 5 years to come?
We think that the regulators could regulate in terms of the local content so that in the near future, we don't know what might happen, but the local market would be saved, sort of.